I am Dr. Rafique Pitafi here going to discuss about the intrauterine device IUT. IUT is a contraceptive device or contraceptive thing that we especially use into the female body for the pregnancy prevention. This is a copper T put into the female body, female uterine. This is a string and IUT, and this is a copper T, IUD copper T. We put into the female body, especially to prevent from the pregnancy point of view. This intrauterine device, how we can put into, this is a device and there is an insertion machine. First we load this into the insertion machine, then insert it into the female body. You can see here, this is a insertion pattern. Here I will show you here type of devices. There are two special type of devices that are present especially in the market or in the medical point of view. Intrauterine devices. First one, that is copper coated IUD, and other is the hormonal IUD. Copper coated and both devices, these are very effective that protect 99% from the pregnancy, and it give protection from the pregnancy around about 3 to 10 years, 3 years, 5 years, 10 years, up to you. That depend on you how much time you are keeping this inside your body. IUD insertion methodology, here already I have told you, this is an insertion machine, and by this one we load and put into the female uterine. This is the string. By this string we can recognize either this is present or this is present inside the uterine body. So by this we can pull and keep out from the uterine body, uterine wall. If it is present inside the female body, then it causes the inflammation. Especially by inflammation, it can kill the sperms when that cross from the female uterus, because pregnancy almost occur inside the uterus and oviduct point of view. And also it protect from the embryological attachment. This is an embryo. By this presence, pregnancy prevention occur. So this one is a methodology. You can see here. Hormonal IUS, hormonal, that possesses the progesterone secretion occur here. By progesterone secretion, there is a narrowing mechanism occurring inside the female cervix, and also this cause the inflammation inside the uterine, and also it effect on the female endometrium. It do not mean support endometrium thickness. Result, fertilized ovum cannot sustain inside the female uterus, and also it can pass via the vagina and also cervical region. It is round about 3 years prevention mechanism. So there is a two mechanism I have already told you. One is known as the copper T, and other is the progesterone. Copper T and progesterone both are preventive, and if you feel any kind of inflammation inside the female body, then you can remove easily from the body. And there is advantages and disadvantages. Advantage: highly effective and very safe, does not interfere with the intercourse, easy to use, long lasting, easy reversible, quick return to fertility, no systematic effect, complications are here. Disadvantages: side effect, including the companion increase the prolonged bleeding, rare complication, that is a proliferation or inflammation, and rare pregnancy ectopic. Insertion and removal of quite removal require the trained professional person. No STI या HIV occur in protection. So here means there is a disadvantages, means by this disadvantages it is very dangerous because we cannot protect it from the HIV AIDS. Thank you very much.